First, could you please tell us a little bit about yourself and your background in mental health?
Absolutely. I am Dr. Marlene Egusquiza. I am a licensed clinical psychologist. I am currently working in private practice, working with diverse age groups, children, adolescents, adults. I also work with geriatric population in skilled nursing facilities. And I am just very passionate about helping people throughout the lifespan to achieve, uh, their mental health goals and to be as healthy as possible.
My next question is, what do you think are some of the biggest mental health challenges that teenagers specifically struggle with today?
Absolutely. So, as we all know, adolescence is a very difficult time. It's a time where, kids are questioning, who am I? They're facing a lot of peer pressure, a lot
Yeah.
of pressure to be accepted by their peers, deciding on what their future is going to look like, how competitive things are. You have to get the good
Mhm.
grades. You have to, do a lot of extracurricular activities, pressure, 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 which this all translates to stress. And
Yeah.
stress is something that obviously leads to mood disturbances. When we talk about stress, we know it's like the underlying cause of anxiety, depression. And oftentimes, when you have this anxiety and depression, this leads to an increase in substance use. So, what we have noticed, and I'm sure we'll talk about later on in this conversation, is
Mhm.
that people sometimes are not seeking services. So, it's easier to find an easy solution that will fix the problem right away. So, they'll engage in substance use, which it tends to become a vicious cycle. And then, instead
Yeah.
of breaking the cycle, it's just exacerbating the problem. And even if we were looking at the statistics, so when we look at the World Health Organization, we're talking about 1 in 7, 10 to 19-year-olds uh, have a mental health condition. So
Mhm.
numbers are increasing significantly. Unfortunately, suicide is the fourth leading cause of death amongst 15 to 29-year-olds, which that's why it's so important that we're looking at the risk factors. So obviously,
Mhm.
a mental health condition is a major risk factor. The stigma behind seeking help,
Mhm.
history of abuse, the lack of support, it's endless. The list is endless.
Yeah, definitely. My next question is, how do you think teenagers can best cope with the various stresses they face as they grow up?
Absolutely. So coping, when we talk about coping skills, I know that's something I do a lot in practice. I always say you have to find what works for you. And I
Mhm.
understand that, obviously, well, may work for you, may not work for me, may not work for whoever. But it's very important to have someone that you can talk to. If we were getting into specific coping skills, having someone to talk to, whether it's your therapist, whether it's a friend, whether it's your parent, it's just
Mhm.
having that support. That's a major coping mechanism. Changing negative cognitions. I know that sometimes you talk to somebody and you're just going to hear all the negative, everything, everything, all the negative. I always like to say,
Mhm.
I know you're facing these challenges, but tell me something positive that's happening in your life. To kind of reframe those negative cognitions, being more mindful. It's no secret that in our society, there's like this constant rush. Everything is hectic in our lives. It's you have to do such and such assignment. You have kids that are not getting adequate sleep because they have so many demands placed on them. So
Mhm.
that leads me to talk a little bit about time management. Time management is a good coping mechanism because you need to know when to say no. You need to know what you can handle, what your threshold
Mhm.
is. And then obviously there's things that you can do like exercise, listening to music, things that help you feel good, making more time for things that help you feel good. Something that I always like to say that I'm sure that whatever or whoever, whichever adolescent is looking at this is probably going to say, what is she saying? But taking a break from screen time, it's
Mhm.
nice to just, I understand that we can't live with all these things, but it's good to put it aside sometimes. Go outside. I have people that, oh no, but I don't have a backyard. But you may have a balcony. If you have a balcony, you have a front door. Just go outside,
Mhm.
get some fresh air, take a deep breath, just live the moment. Take a break
Mhm.
sometimes.
Yeah, definitely. Like time management's like very important and putting aside time for yourself.
Absolutely.
My next question is, after the pandemic, did you notice an increase in mental health struggles among people?
Absolutely. So we know that the pandemic, for many of us, is something that shook us to our core. Why? Because it's the unknown.
Hmm.
We don't like the unknown. We like to have a response to things. We like to have more concrete direction as to where we're going. And we know the pandemic was something that there was a period of isolation for many people.
Hmm.
Especially for adolescents, we all know how important friend groups are during this stage of life,
Hmm.
and being away from your friends, unable to do things that you previously liked. Then we also have people who are and are still struggling with loss, with grief, with fear. Fear was something very imminent during that time, because in essence, it's the change that it brought. Not a lot of us cope well with change. Change is something,
Yeah.
again, 'cause it's the unknown, right? So
Yeah.
so when you're faced with change, it's kind of like, oh, okay, so we kind of have to, like, you know, recenter ourselves and kind of, redirect and
Hmm.
fit the change and integrate it into our daily lives.
Yeah.
Yes,
Yeah.
the short answer is absolutely. There was an increase in a lot of mental health, difficulties, complications.
Yeah, for sure. My next question is, what are some tips you have for people in order to keep up their mental health, like in general?
Absolutely. So in general, slow down, take it easy, check in with yourself. This is imminent because sometimes we're just taking in and taking in and taking in, and we're not really evaluating the effect that that has on us. So it's good that you ask yourself, are you overwhelmed? Do you need a break? What's going on? Check in with yourself so you can know when it's appropriate to seek help, to do something different. Make time for activities that you enjoy. I cannot reiterate this enough. Sometimes we have so many responsibilities placed on us, and I'm sure that a lot of adolescents can attest to this. The older you
Mhm.
get, the more responsibility that comes with that. It's kind of like a
Yeah.
package deal. So just knowing, how to slow down, how to cope with it, how to integrate activities that you enjoy. Rest. Rest is something that is very important. You need to sleep. One of the main things that you can ask every single one of my patients is, I ask, are you sleeping? Because that's a major indicator that something's going on when you're unable to sleep. When you're feeling so overwhelmed that it's cutting into your time to rest. So it's important to just, again, slow down, take a break, sleep. You need to you need to feed your body healthy food. You need to make sure that you take care of yourself in every single aspect.
Yeah, I know sleep is like definitely something like teens especially have to work on.
Exactly. And we all know how many of you stay, I don't want to say you specifically, but how many stay up on their phones, on social media. So knowing when to, again, put it down, take a break, just have time for you, for your well-being.
Yeah, definitely. My next question is, how do you know when a mental health struggle is more than just a temporary occurrence and may be indicative of a condition or a disorder?
Absolutely. So we all have to remind ourselves that each of us have our days. None of us are perfect. There are days that could be a little difficult to cope with because of what, XYZ could be going on during those days. So when to know that this is more indicative of a mental health disorder is when we look at frequency, severity, and the level of impairment that it's having on your daily life. So you can tell me, oh yes, yesterday I cried. Okay, that's fine. That's okay. Everybody cries. Like it's okay. But now if you're telling me this is going on more often than not, I'm to the point that I can't get out of bed. When you kind of see like a pattern that it's not your baseline, that it's keeping you from functioning, that it's affecting your functioning in different domains, whether it's socially, academically. So again, frequency, severity, and level of impairment. Those are the three things that we tend to look at as. major indicators.
Okay, yeah, that makes sense. My next question is, what are some of the major barriers that patients face when seeking mental health care?
So one of the major barriers that even people that seek services struggle with, the main thing is stigma. I cannot tell you how many people come into my office and say, I'm not crazy.
Hmm.
Nobody said you. This is not, coming to see a mental health professional does not equate to being crazy. It's knowing when to find help. That's actually brave of you. It's not crazy. It's actually sane of you to get the
Hmm.
help that you need when you need it.
Hmm.
Another barrier that we tend to see a lot is finances. Having access to care. Not a lot of people have health insurance. Not a lot of people have transportation. And even when we talk about access to care, is even the availability of providers in your area. Sometimes there's people that go on a waiting list, and even though they have a significant need, there's not enough providers for patients, for the amount of patients. So that's a major barrier in care. And finding someone you feel comfortable speaking to. Just because you have a therapist, it doesn't necessarily mean that you feel comfortable speaking to that therapist. So it's good
Hmm.
to know, is this the right fit for me? I always
Yeah.
like to check in with my patients and ask them, how are you feeling? Because it's not about me, it's about the patient. It's about the patient's
Hmm.
wellness. And if it's not a good fit for whatever reason, everybody's different. Sometimes people just don't see eye to eye, and that's okay. There's no problem with that. It's just a matter of knowing it and acknowledging it and just doing what's going to be best for the patient.
Yeah, definitely. And I know you just said that stigma is like one of the major barriers to care. So, what are some of the ways to reduce stigma around mental health and encourage people to seek care instead?
Absolutely. Raising awareness. That's the best thing that we can do. I know that we hear about this all the time, but the question is, how do we raise awareness? So I always like to say that we cannot separate mental health from physical health. We got to look at the human as a whole, right?
Hmm.
And one of the things that we tend to overlook is our mental health, because we tend to go to the doctor when, oh my god, I have a headache, or my foot hurts, or any part of our bodies hurt, and we tend to seek medical attention. But when we have emotional pain, we tend to just put it aside and think, I can deal with this, I don't need to talk to anybody. And yes, oftentimes we can cope with many, stressors. I think that humans, we were built to be resilient, because,
Hmm.
but sometimes you reach your threshold and you kind of need other techniques. You just need to talk it out. So to reduce, or in an effort to reduce stigma, we want to create more awareness, having providers provide referrals, normalizing seeking services. Um, Now that I'm in private practice, I have had the opportunity to talk to different specialties, and I
Hmm.
have different providers that provide referrals. But one of the major challenges that they providers themselves reach is, how do I tell someone, do you need to talk to someone?
Hmm.
Simply asking, do you feel like you would need to talk to someone? There's nothing wrong with you doing that. Maybe
Hmm.
if we have providers get into the habit of doing that, pediatricians, primary care physicians, uh, multiple specialties, it's just knowing when to guide your patient the right direction.
Hmm.
Having schools make more referrals. I will tell you, when we look at the education system, they often make referrals for children, for adolescents who are facing more behavioral disturbances. So mood
Hmm.
tends to be overlooked, which sometimes the behavior could be a symptom of the mood as well. But it's
Yeah.
just, again, increasing the awareness, making it comfortable for people to seek services, not
Mhm.
just, okay, you're a behavior issue, so you need to see somebody because your behavior, we can't manage it. No,
Yeah.
again, it's just finding other ways to navigate that.
Yeah, definitely. Like awareness is a huge part of making sure the stigma's gone.
Something that would be ideal is if seeing a mental health professional could be seen like seeing your primary care physician or your pediatrician. That you
Yeah.
want to go on a yearly basis or twice a year, just to make sure that your labs are good and everything is,
Yeah.
able to say it like that. So it would be ideal if we can do that with our mental health as well. It's not just, okay, I'm waiting till things get very severe for me to seek services. I always like to say prevention, that this is my motto, prevention is better than intervention. So if you can prevent something from getting worse, it's better to intervene early than having to wait, it's just going to be more difficult. So I'll give you an example. If you have a patient that's depressed, if they fall into a major depressive episode, and it comes to the point where it's really severe, it's going to take more time for that patient to get out of that episode than, if you intervene at an earlier phase of the
Yeah.
condition.
Yeah, definitely. My next question is, what should someone do if they notice a loved one exhibiting signs of a mental health condition?
This is a very good question because I know that we all have our families and we've all observed one thing or the next. One of the main things that you can do is be supportive. Support is a major protective factor. So, just being there for the person, talking to the person, even if you can't talk, if you don't know what to say, just being there, that makes a huge difference. But it's also knowing when to look out, when to encourage your loved one that it's time to go see someone. Maybe you can even, if it's a parent, obviously taking their child and being with their child along the way. I
Hmm.
always like to phrase it when I'm working with families that, we're a team. We're working with the family. We're not just working with the adolescent. We're working with, we're coming together. We're collaborating for the well-being of the person. So it's imperative to have that support, number one, and number two, to just know when to seek help.
Hmm.
Sometimes we think that we have like a superhero complex, and it's like, okay, we can
Hmm.
fix it, but it's good to know when it's necessary to look for alternative options.
Hmm. And I know you were just speaking on getting help. So, what are some of the best resources for teenagers to reach out to if they are experiencing a mental health condition?
The best is to, I would say, the first line of treatment would be to look for a mental health provider, whether it's a counselor, whether it's a therapist, a psychologist, just or a psychiatrist if need be. But it's just looking for help, just knowing that you have someone that you can see on a consistent basis, someone that you help you work through the difficulties that you're facing. There's also other resources such as, I don't know who's familiarized with NAMI, which is the National Alliance on Mental Illness. They have a free helpline. And that free helpline, I know some people don't like to talk on the phone now, but you can text, you can chat, you can call if you felt that you wanted to speak to someone, directly. And, there's also, especially if you're in crisis, the crisis hotline, just dialing 988 or the National Suicide Prevention Hotline, which is 800-273-8255. So again, these are just resources that are available to everyone because I know that sometimes it's not feasible to have your clinician work with you for whatever
Hmm.
reason. Sometimes families are not receptive to getting help. Um, that's another issue that we face a lot in practice that,
Hmm.
oh, why is this child presenting with depression if they have everything? I give them everything. They have, all the electronics that they want all the money. You know, Parents always try to rationalize it. And I'm not trying to bash parents and by no
Hmm.
way, I'm not trying to bash anybody, but it's just something we tend to see more often than not.
Yeah. And my final question is, what are some of the mental health struggles that minority teenagers may experience in particular?
So minorities, we know that as minorities, because I'm a minority myself, we face similar challenges than
Hmm.
any other teenager, right? But in addition to that, being different,
Hmm.
looking, sounding, eating different foods, that sometimes makes children targets. So
Hmm.
when you're in a school or when you're in a social setting where you're different, that tends to again make you the target. It tends to um, make you feel isolated, it doesn't make you feel like you're part of the group. But it's
Hmm.
important for us, for whatever minority child is listening to me at this moment, for you to, it's okay to be different. You know, be you, love yourself, love your culture, your background, because the more that you do that, the more that others are going to respect you and appreciate you for who you are. Because regardless
Hmm.
whether you're a minority or not, everybody is different. And it's good that
Hmm.
it doesn't matter if you're talking to two kids that were raised in the same neighborhood and similar backgrounds. Everybody is different, and it's okay. You know, diversity is something that we're coming across more than ever. The more that we grow, that we expand, we're seeing that diversity is more around us than we had ever imagined.
Hmm.
um and it's not that it's a new thing, it's just that, you know, we're becoming more aware of the differences around us, and it's okay to be different. You know, if there's a language barrier, I understand that it could be very challenging, but again, you know, take your time, you know,
Hmm.
to kind of acculturate to the new culture, the mainstream culture.
Yes, definitely. That was my last question, so thank you very much for your time.